Welcome back, Fact Not Fiction fans. It's time for our mailbag where we answer questions that you all have sent us. And what better way than to answer it with our expert, Nurse Valley. Hey.
So another question from our mailbag from you is, what is asexuality? So we hear a lot about heterosexuality, homosexuality, and bisexuality, but there's another term called asexuality. What is asexuality, AJ?
Well, asexuality is not being attracted to other people. You can still be aroused, but it's not necessarily being attracted to other people, and it's perfectly normal. It's not a sexual identity.
So could a young person visit their healthcare provider with these concerns?
I think what's most important is that you're comfortable with yourself and the choices that you make for your body and for you. But you can see a healthcare provider anytime if you have any questions or concerns.
Another question. I just had sex last night. Is it too early for me to take a pregnancy test today?
Yes, absolutely. That would be too early to determine whether you're pregnant or not. It can take up to 3 weeks.
Why?
Isn't that because, so it takes a little while for the sperm, maybe up to a week for the sperm to fertilize the egg, and then it takes some more time for that egg to implant itself in a woman's uterus. And then doesn't it take even some more time after that for the hormone that's associated with pregnancy to start showing up in the body? And isn't that what that test, a pregnancy test, is looking for, that hormone?
That's right.
What's the hormone?
HCG.
Okay.
So that pregnancy test is testing the level of the HCG hormone in your body. And the best results come from doing that test first thing in the morning with your first pee.
So you're saying I should probably wait until I have like a missed period? Because that's about, 3-4 weeks. So that should be enough time, right?
That's a great time to test. But some people don't have regular cycles. So if you're unsure about that, you can go ahead and test if you suspect that you're pregnant.
Can I go to my healthcare professional?
You can. Your healthcare professional can do that test for you there, the testing for HCG with the urine test, or they can even do a more effective test, which is where they draw blood and test for pregnancy.
So another question we got. I'm about to have sex for the first time. Is it safe to just use a condom, or do I need backup birth control?
So condoms can be a great form of prevention to prevent you from getting pregnant and STIs. But also it's important to add an additional form of birth control if you know that you're going to have sex in the future, so that you can cover it even more effectively. So those forms of birth control would be birth control pills, or the patch, the ring, the Implanon, Depo-Provera, IUDs.
What about if I'm just starting my birth control pack for the first time? Do I need to use a backup form then?
Good point. It's equally important that you're using a backup method with the barrier methods if you're going to be having sex and you're just starting a new form of birth control.
What about if I'm switching packs?
So if you're switching packs, the same thing. It can take up to a month for that to work effectively. So using a backup method would help prevent you from getting pregnant.
Oh, well, thank you so much, Nurse Valley.
So basically, condoms are our friends.
That's right. Condoms are our friends.
Condoms are our friends.
When they're used properly.
Right.
Yes.
Thank you.
You're welcome.
Bye,
Take care, guys.